Hi, I'm Dr. Martin Rutherford. I'm a certified functional medicine practitioner and a chiropractor since 1979.
I'm Dr. Randall Gates. I'm a board-certified chiropractic neurologist as well as being a chiropractor.
And in this particular segment, our board-certified chiropractic neurologist is going to discuss some of the latest findings that he has been researching, and I think you were just involved in a very recent updating seminar
on traumatic brain injury.
On traumatic brain injuries, concussions, just in the last 10 days or so. So Dr. Gates is going to, in now and future snippets, probably share some of the concussion data that's out there, and it's an ever-growing field now, thanks to the NFL, thanks to their players' lawsuits, but I think it's a legitimate field to be concerned about. I know myself, I've had a few concussions in my time, and only now realize why certain things happened back then and why I lost certain functions and so on and so forth. So it's a very exciting area. The board-certified chiropractic neurologist, it is an area of intense focus for them. I would say that more or less Dr. Carrick, who developed this discipline, kind of cut his teeth on concussions
right now, yeah.
And he's very, very much involved right now. He was involved in getting one of the one of the National Hockey League players, Sidney Crosby, back on the ice about a year and a half, 2 years ago, when standard procedures didn't work. So we're going to start sharing some of that data with you. Today's data is going to be about some new testing relative to post-concussion syndrome, and Dr. Gates will discuss that with you in some detail.
Exactly. So the post-concussion syndrome patient, the patient who gets a concussion, and then after a month they're still having symptoms in essence, or after a certain length of time. And this is a growing phenomena, something that used to be poo-pooed, as we've said in other videos, by neurologists, because let's go back to the 1990s, somebody gets hurt in the workplace, they get a concussion, and then they kept saying, hey, months later, I'm still having these symptoms, and it was thought that they were just saying that to get money from their employer, in essence. Well, we now know that post-concussion, car accidents. We now know that post-concussion syndrome is a very real entity, and the NFL's leadership in this is really prompting the scientific community to come up with data in terms of what is actually going on here, and it's really, as a practitioner, it's almost hard to talk to concussion patients and post-concussion syndrome patients because they'll say, well, what's going on? And lots of times people just say, we don't really know yet. You know, the literature is so in its naive stages. It's pretty interesting. So we're going to try and bring out the newest literature as it comes out, because people are researching the subject now, so we can put together an idea of what is actually going on. We did a whole topic on concussion, and you can find that on our website, powerhealthtalk.com. Today we're going to go through an article. It's out of Brain Injury. It's from this month, and they were talking about how can we predict who is going to get post-concussion syndrome. We know from other studies in pediatrics where if the person had depression or anxiety or migraines going into the concussion, then they get a concussion, they have a much increased likelihood of developing post-concussion syndrome, where they tend to feel foggy and they still have headaches, they may have dizziness or vertigo, things of that nature, trouble concentrating, light sensitivity. So in this article out of Brain Injury from this month, they talk about, okay, we're going to take the CT findings, we're going to take CAT scans, we're going to see if they had seizures, and we're going to see if they had a little bleed in their brain, even though they didn't have a severe brain injury where, you know, they had to have a neurosurgery. But they had this thing called the mild traumatic brain injury. If you've had a post-concussion syndrome, I'm sure you've heard that term. And then they're looking at this lab marker called S100B, which is now being associated with neurotrauma. And it's been a little controversial. Some studies have said, you know, it's useless in this setting. Other studies have said it's good. And this study proclaims that if you look at the entire picture as to whether the person had seizures when they're presenting, if they had some CT abnormalities with this S100B, you can actually accurately predict who's going to get post-concussion syndrome. So that's kind of cool, because this is a novel finding.
Doing a history and an exam and a test.
Exactly.
That's novel.
Right.
Okay.
Right. Exactly.
But yeah, It's really good stuff. I know I've had concussions. They have altered the direction of my life at different points in time, and it's just been kind of really cool to be a part of a practice in which we have uh, a lot of attention on what I think is the most underappreciated aspect of chronic pain. We do a lot of chronic pain. It's the vast majority of our practice, but concussions are directly linked to brain function, obviously, and chiropractic neurologists are very well versed in this field. It's been really comforting for me to understand some of the things that have been going on, and it's helped me to deal with it much better. So I hope that was helpful, and we're going to be doing future topics on this. So for those of you who have suffered what you think is a concussion, you have the symptoms of maybe you're a little foggy, maybe you walk in the room so you don't know where you are still, maybe your memory's a little bit less than it should be, or you just feel off, and everybody's telling you it's okay, you might want to watch some of these and kind of see if you see yourself in these snippets, and or refer back to the 1 hour 40 minutes. I think it was about 40 or 45 minutes to one on concussion, and see if that might be helpful to you. Okay? So hopefully that is helpful to you to know that there's a lab test now.
So if you have any other questions, go to powerhealthtalk.com, forward them to us there, and we appreciate you watching.